suffer from back and neck pain, injury, aging, and serious spine disorders.
Today, our expert in relieving back and neck pain, Dr. Christopher Miller, is here to talk about how he treats some of these disorders. And you really have an interesting job because every day you're treating people that are in pain. That's the common denominator. But you have so many different things, so many different causes. And that's got to be really interesting in your line of work.
Well, it is, and we always want to make sure we diagnose it properly and know exactly what's going on. But I know in the past segments I've talked a lot about different chronic conditions of the spine that are leading to a lot of pain. And usually there are things like degenerative disc disease, herniated discs, or even spinal stenosis. So I just want to share with your viewers a little bit more what these conditions actually are and how it can be affecting them.
Mm-hmm. Well, and you actually brought in some examples here of exactly what our spine looks like when it's normal, and then what some of these different conditions can look like on the inside, which I think is really fascinating.
Well, the models we have here show the different stages of spinal decay or degeneration, and it's very similar to gum disease or tooth decay. And it's, age has a part to play in this, but it has a lot to do with just stress in our lives and neglect. Just too many negative things that are going on over time and not enough positive things that have been done to keep it healthy. But we go from a healthy model of the spine down to a permanent change where there's no reversing that, where the spine has actually fused itself together. But it all generally starts with degenerative disc disease, and these discs are pads and spacers between the bones to separate them so there's plenty of space for the nerves, but also to act as a shock absorber. So when you're moving, I can push on that, and there's some cushioning effect by that disc there in the middle. But as time goes on and you wear it out, these discs start to dry up and thin down, and you can see these changes here. They change sort of like from a moist sponge to a dried sponge, where they're shrunken down, dried up, brittle, and hard. I can push on that, and you just see there's not really any give there with that disc. But also, as it thins down, you can see the change in the opening of these nerves. This has plenty of space, where this one is very, very small and crowded, and that's a form of spinal stenosis. All spinal stenosis means it's just crowding or narrowing of an opening for the nerves. So when you have degenerative disc disease, you're probably going to get a little bit of spinal stenosis as well. And then, as these discs are dry, think of that dried sponge. If you're twisting that back and forth quite a bit, you're probably going to rip it or tear it, and that's what happens to these discs. That starts to lead to herniated or bulging discs, where you've torn that disc material and the pressure starts working its way out into the nerves. Here's a side model of a herniated disc pushing right into that nerve.
Oh my.
So that's going to be very, very painful.
That's pain. Well, the visuals tell a great story, but we don't see what's going on inside our bodies. Most of the time, we know it when we feel pain and there are problems, and we can't do what we used to be able to do. And so what are some of the symptoms that people come to you with that tell you that something's happening on the inside?
Well, usually it's just becomes more chronic pain, whether it's the neck or lower back, where it just doesn't seem to go away, or it's becoming more and more frequent. But then as it continues to get worse, maybe you start getting radicular symptoms into the legs or the arms, which could be shooting pain, numbness and tingling, or even weakness of the extremities. I've talked before, maybe you have a problem where you're dropping mugs, or as you walk, you feel like your leg's about to give out and you're going to fall down. So those are the more serious conditions, probably from a bulging or herniated disc many times.
And so talk to us about the treatment options that are out there. I guess I'm particularly struck by the fact that once you get to the point where maybe you have herniated discs and this pain becomes more than just maybe a back or a neck issue, and it really starts to impact other parts of your body, it sounds like that's the point when traditionally people may consider injections or surgery.
Yeah,
you don't go that route.
There are many different treatment options, and I generally talk to that with patients about what they have available, and we can refer out to those specialists if need be. But we take a non-invasive approach. We're trying to get these problems corrected and move you back in this direction to alleviate pain, not just do things to mask the pain. And that's the big difference. And one of the treatments that we offer is called true non-surgical spinal decompression, and we use a machine called the DRX 9000C. And it's just a non-invasive way we can specifically target which disc level is involved and gently pull the bone above and below gently apart to relieve pressure on the disc and the nerve, and actually many times retract that disc back in off of the nerves and rehydrate those discs, going back from that dried sponge more to the moist sponge state.
We've had patients on the show before, and they've talked about the whole process and really how this machine really helps them feel better. And actually, it's very minimal. You're not really having to work, as people people think that you might on some of these machines, they're doing a lot of the work for you.
Yeah, and we lead them by the hand and do as much as we can, but we also try to get them involved outside the office so there's consistent improvement. But you see the image here, and some people in pain might think that's very scary. To get pulled like that is probably going to hurt. But the most unique thing about this machine is it interacts with a patient. They're going to have a tendency to spasm. Their body's going to want to fight this a little bit in the beginning, and instead of the machine just trying to pull harder and overpower them, it can sense that resistance or muscle spasm, and it just backs off, and it allows the body to relax and the patient to calm down, and it gently starts to pull again. So it's really a comfortable treatment. I've had patients sleep on the machine during treatments, which is just fantastic. When they're facing the injections like you talked about or surgery, and they can just sleep during a treatment. I think that's pretty awesome.
Well, and it's interesting because as we've learned from you through the last couple of years, the body then is almost able to heal itself, or at least rejuvenate itself when you go through the process.
Yep. Yeah. If you do the right things, it is possible. You want to be the right candidate, and we make sure that these patients are. But it's just a great experience because you don't have to resort to invasive procedures with all the scary side effects. There's no concern of death or paralysis with this kind of treatment. So patients really enjoy that. They can continue living their lives and go through the treatments and get help.
Yeah, so they can actually take you up on some of these different things that you're talking about. You're offering a special right now for people who call. They can get some great discounts, and so you can call today to get the consultation and exam, and you have a $39 new patient special. That's a great deal.
So that's the first step to get started. Come in and we'll talk a little bit and talk about what you've been through and what your complaints are. If it seems like it's something we might be able to help, we'll probably proceed with the examination and just do some testing to see how it's affecting your body. Right. And then we always like to have an 8 West special. So for the first 8 callers, we're going to offer free x-rays as well.
Which is a really important starting point because you make sure that you want to know exactly what's going on inside each individual person's back and spine.
Right. Yeah. So we'll be able to see a lot of the problems we talked about and diagnose that properly.
Great. Thanks, Dr. Miller.
Thanks for having me again. Hope that helped with your viewers.
Oh, yeah. Very educational.
Yeah.
Good.
We'll be right back.
This is 8 West.